I'm Dr. Kelsey, and this is Dr. Becky with Premier Chiropractic. We're here to talk to you today about low back pain post-pregnancy. One of the common things is diastasis recti. It's a common thing with pregnancy. It can happen with other issues too, like lifting and other things. But with pregnancy, when your belly expands quickly, the muscle that's attached by connective tissue in the middle, it stretches and gets weaker. And therefore, when it goes back down, it's not quite as strong as it used to be. And when your core muscles aren't quite as strong, then your low back pain, it really aggravates it. So we're going to talk to you today about what happens and how to address those with some exercises you can do at home. If you have any concerns that you might have it, we'll show you a self-check, but it's not a bad idea to get checked out by your OB or your chiropractor just in case you have any questions. We'll start with having Dr. Becky lay on her back. And then you want to engage just the front of the muscles. So you lift your head up just slightly and not all the way as in a crunch, because then you have too much muscles contracting where you won't be able to feel as much. So she lifts it up just slightly and you push down at your belly button with 2 fingers. And you want to be perpendicular to the belly button, and you push down as far as you can go until you feel a stop. And then you move up 2 feet or 2 inches. And then you feel, and then you move down 2 inches and you feel. And what you're looking for is that the muscle is never more than 2 finger widths apart at a time. And if you do have that, then you probably have a slight diastasis recti. Some can be quite a bit stretched, and that would be something that should probably be addressed by a physician. I'll have you do a couple exercises with me now. The first one is going to be belly breathing. This is a great one you can do at home. Where you have one hand on your chest, and then one hand on your belly, and then you're going to take deep breaths with your belly. So you want to make sure that this hand isn't moving and this hand does all the movement. You take a deep breath. As you can see, Dr. Becky's hand will rise, and it will fall. And you want to focus on using your muscles to pull in the breath and to release the breath. You're going to do 10 of these deep breaths. They're good for you anyway.
And my upper hand should not be moving. Right?
And your upper hand should not be moving. You should not use your chest at all for these deep breaths. And then a second exercise we're going to have you do is heel slides. This is great because it works on your core and some of your hip flexors. So what you're going to do is slide your heel, yep, and then you're going to bring it up. So it's called a heel slide. And then what you're using, yep, your low back and your core muscles, and you alternate. And then if you really want to engage your core, we'll do alternating hands and heels. Good. This is a great exercise to do at home. Make sure though you are engaging your core and that your pelvis is tilted so that it's fully core muscles.
Oh, wrong one.
Yep, alternating. Yep, there we go.
So my hips should be...
Your hips should be tilted where your belly button is touching the table. Okay. Okay, and then in our last one, I'll have you stand up with me. Exercise is abdominal drawing in. And what you're going to do is make sure your pelvis is tilted. And
back and not forward, right? So here's forward.
So here's forward and here's back. And you want to take a deep breath. You suck it in like you're trying to put on a tight pair of jeans, and you just want to make sure that your belly button is as close to the spine as you can make it. You should be able to breathe normally though and take 10 breaths. And then just keep your belly in. Yep.
So this is the last exercise of 3?
Yeah.
Okay, so Dr. Kelsey has gone over 3 exercises that are great for diastasis recti. If it's something that you think you have, it's really important to get diagnosed by a healthcare practitioner. You can go to your OB, or as chiropractors, we can address that in our office as well. The other thing that's happening is we are getting low back pain because as the abdominal muscles become weak and weak, we are losing range of motion in our low back. It needs to compensate for that. So if this is something you have, if you've been struggling with low back pain because you have this going on, go ahead and give our office a call and we would be more than happy to see you.